I'm concerned for the 1,400 men, women and children who are at high risk of COVID-19 infection in our overcrowded immigration detention facilities in Australia, PNG and Nauru. Our government acknowledges this risk, yet ignores calls from thousands of health professionals like me to release these people into community detention. Furthermore, many asylum seekers on temporary protection and bridging visas are ineligible for Centrelink support and Medicare. Is it not time that we said game over when it comes to the inhumane treatment of asylum seekers by our government?
John Anderson.
Well, if we get this wrong coming out of this, can I make 2 points? We won't be able to afford to help anyone, needy or unneedy. We are really talking about our economic future, and I'd be the first to say we ought to look after the marginalised and the disadvantaged, but we need to focus on the need to pull together and accept our responsibilities and to do what we can to rebuild and to be good international citizens. Refugees are always a problem, and I pay tribute, for example, to Craig for some of the work that he's done there. Okay. But the way this may play out globally could result in vastly more dispossessed and troubled people looking for escape. We need to be active on the ground, and to do that, we have to be a well enough resourced country. I'm sorry to have to say to it, but I think we've spent a bit of time focusing on the concerns of various people in the community who we need to be cognizant of. But frankly, we're not going to be able to do anything for any of them if we don't find a way through this that ensures that we're able to recover our economic and social cohesion as a nation.
Julie McCrossan.
Could I comment? I'm a gay woman. I'm 65. I was alive when HIV/AIDS began and we grappled with this pandemic. Certain wonderful things were done in Australia, and I think our nation at the moment is doing many of these things, but one thing they're not doing. So how we overcame HIV/AIDS and reduced it in our country was that it became a bipartisan issue, so the different parties came together. The political leaders came together with the medical and health sector, and they also came together with the most at-risk people, which in that time was homosexuals, self-injecting drug users, and people we called men having sex with men. These were men who didn't think of themselves as homosexual, often married with children, but they did actually have sex with men at times. And our political leaders and our health leaders engaged intimately with those groups. They overcame the stigma. And why did they do it? Because they weren't going to defeat HIV/AIDS and stop it spreading into the broader community unless they engaged with those groups. And that's why I'd say to John Anderson, this isn't about a mob over there we don't have to worry about while we look after the bulk of Australia. If we don't look after the most vulnerable, the prisoners, the kids in juvenile justice, the homeless, the people with cognitive and mental health and alcohol issues that have made them brain damaged, so they're not hearing the social distancing and other messages, then we will not lower the curve so low that we can eliminate this. We have to care about these people.
So we can see the complexity.
I'm not advocating that we don't care about them. I'm just saying that it requires a resourceful, including in economic terms, society to be able to meet those needs. If you doubt it, look at the struggles that are going on in poorer countries, countries that can't get their act together politically.
You can see the complexity of the argument here.
Of course.
Yeah. So what's the answer? What do you do now with these individuals that are clearly at risk?
Well, the asylum seekers and refugees who are in the alternative places of detention should be released into community immediately. I mean, all of the medical community, or vast majority of them, are calling for that to happen now. In a pandemic, you know, that most of us, you know, it's the first time in our lifetime we've seen this. The best decisions that have happened from government level have been guided by medical and health professionals, and they're saying that these APODs in particular and the detention centres are potential hotspots for COVID-19. I've been to the Mantra in Melbourne and I've seen the conditions there, and it's patently not safe for these people. So my question to Australia is, how is it that we make an exception for some of these groups of society? And so if this is about all being together now, and it certainly must be, and building community and building social cohesion is a wonderful term, But then no one can miss out. And Julie's talking about Indigenous, so there's many parts of society who have been missing out. And the way that we've demonised and treated asylum seekers and refugees in the last decade is horrendous. It's been deeply politicised, and Australia has turned ourselves in contortions in order to not just provide these people, human beings, with their basic human rights, and that is they have a right to seek asylum. So these people, many of them have been medically evacuated to Australia, so underlying chronic health conditions and compromised immune systems are two of the main risk factors for COVID-19. That's exactly what these people have. So in an alternate world where where Australia hasn't been through the last decade, where we've put these people in a horrible position, they would be out already. They'd be out like that. Of course they would. Most Australians would very quickly say, of course you need to put these people in community detention. But let's not only talk about people onshore. We've got also this cohort, I think it's around still 400 offshore as well. There's about 220 in Port Moresby. I went there last October. I saw the conditions they're in. I saw how heavily medicated they are. I saw the mental health, severe issues after 7 years of deprivation of freedom that they've had. Now, we go back to 2013 when Australia had a problem in terms of immigration and found a solution. That solution has proven to be trading one set of lives for another and for the well-being and health of these human beings. So it surely must be time that as a country we say, come on guys, we are part of the international community here, and this pandemic, along with I think climate change as well, as the big two global issues, which are teaching to Australians and to the rest of the world that we are intimately connected. And these major global issues are I think, starting to at least get Australians to look at our position in the world. And we can't breach the rights of these people and then go preaching to China around their human rights, whether it's with this pandemic or otherwise. We have to have a basic benchmark, a threshold, a basic threshold beneath which we will not descend. And we have descended in relation to these asylum seekers and refugees, and we should put it right, guys.